Hello, I'm Denise Weisman, and I'm going to share with you our HRC Impact Network Map. Before we begin, let's talk about the problem that we're seeking to solve. Many innovators are working to reimagine a more inclusive and equitable healthcare model, but their efforts are fragmented and disconnected, missing opportunities for collaboration and acceleration of positive change. HRC unites fragmented healthcare reform efforts by creating a trusted, collaborative network. We connect purpose-driven individuals and organizations, offering resources and support to address root causes and accelerate meaningful, sustainable change. We will transform healthcare together by ensuring no one fights this battle alone. Our mission is to identify, connect, support, and illuminate every healthcare changemaker. And if you're questioning whether or not you're a change maker, we would say that if you see the need to challenge and reinvent our healthcare system to one that is health and care, you are a healthcare change maker. We envision a world where healthcare reform is driven by collective action and where change makers work together to create a compassionate and equitable system that prioritizes the health and wellness of every individual. We are creating a social network map as part of our initial efforts. A social network map is a visual representation of the relationships and connections between individuals or organizations within a network. It highlights how people are linked, making it easier to identify potential collaborations, shared goals, and opportunities for deeper engagement within the community. What is the value of this map to you? It's the power of connection. The map is a visual tool designed to make connections between healthcare changemakers visible, fostering collaboration and reducing isolation, highlighting purpose and belonging. Being a part of the map signals that individuals and organizations are part of something bigger, a collaborative effort to reinvent healthcare. Visibility of contributions. The map allows members to see not only their own role in the healthcare system, but also how their work intersects with others. Building trust and collaboration. Our map is not just about making connections, it's about deepening them. By identifying relationships and shared goals, we seek to build trust and enable members to co-create solutions more effectively. And it's about driving systemic change. HRC envisions a healthcare system that works for all. The social network map is a tool that will assist in this vision by making it possible to address systemic issues collectively rather than in silos. This collective approach increases the chances of driving sustainable and meaningful transformation. So let's take a look at the map. The map in this early stage has a selected number of members displayed. This map is growing over time, and we are encouraged by those who are beginning to join it. This view is that of each of the members on the map and the connections that they've identified. When you hover over one of the circles, which is an individual, you'll see that it grays out any non-connections. So in this case, this is an individual that I've identified a connection with. Let's look at Michelle to look at this further. So again, if I hover over her, you'll see those individuals she's identified a connection with or have identified a connection with her. I can now see her bio. And here you'll learn that she believes in a future of healthcare that is driven by entrepreneurs and intrapreneurs and the other innovators as they learn to support and collaborate with each other. So her vision aligns very much with that of HRC. So we're focusing on Michelle right now. If we were to hit over here, I can focus the entire view on Michelle. So now, of course, you see that Michelle is in the center because we're focusing on Michelle. And what this enables us to do is to look more closely at her connections. We're going to see a couple different things here. There are connection lines that are gray, blue, and green. These are different strength of connections. If I go down here to the connector filter and I were to hit acquaintance, you'll see that none of those are just an acquaintance. But if I picked on aware of their work, you're going to see that Michelle said that of Lonnie and Lonnie said that of Michelle. And how do I know that other than there's two loops here? If I click on the loop, you're going to see here that Michelle said that of Lonnie. And the weight 1 is that aware of their work status. You'll see if I click on this one, Lonnie also said that about Michelle. So let's look further at this. If we go to a generative interaction, this means that they have had an engagement where something productive happened of it in regards to a conversation or a deepening of relationship. In this case, you'll see that there's just one loop. And so this is Michelle's saying that of Elaine and of Tom and of Dawn. The others have yet to come out and to say that the same of Michelle. Doesn't mean that relationship does not exist. It just means they have not yet come out here and done that. The fourth level is collaborator. So you can see here those with whom Michelle has identified she is in collaborative relationships with, and you'll see that I have said that in return to Michelle. So here's the power of this map: the identification of those individuals you're connected with, your level of relationship, and the awareness of the others that you may want to connect with, have generative engagements with, and become a collaborator with. What we're hoping to see is that this collaboration will deepen so that we move those who are acquaintances or aware of work to generative interactions, and from generative interactions to collaboration. There are a number of views in this map. The next one I'm going to focus on is geo. For those members of HRC on the map who have come in and given us their postal code, we now have their position located on the map. This enables us to begin to see where there's regional clusters. So if we look at this at an even higher level, you can see that we have individuals in other countries who are members of HRC. You can also see that we have a number of people who are floating down in the ocean here, and that's because they have yet to come in and filled out their profile with their postal code. Once they do, they will get on the map to wherever it is that they're located. The last view I'll show you is one that's under development, but that's areas of focus. So when you complete your profile, one of the questions is area of focus. And if I were to filter on this, let's say primary care for all. Now you can see those individuals who have selected that as an area of focus. What you'll be able to do is identify, are you connected with these individuals already? And if not, perhaps you might want to, because that is also an area of focus for you. This is one of the ways that we'll be able to identify within our network those who are interested in certain elements of work within this highly complex system that we're seeking to reinvent. We hope to include you on this map. At this time, we do have a public access space open to our network. That is just a small segment of the community platform that we're building. Those members, because it is free access, will not be on the map. However, we will be opening soon that level of membership that gives you access to be on the map and to have access to and engage with the map, as well as the opportunities for member-only events and our many other collaborative engagements. Join us now, whether in the public space just to dip your toe in, or in the soon-to-be-opened membership space, and help us to reinvent healthcare together.